Welcome to another edition of the Business and Personal Podcast, where we bring you closer to those that you do business with. And I'm real excited today to have Dr. Rona Wadle on with us. She's been in the medical field for more than 20 years, but just has a really unique story of why she opened her own business, Renew My Wellness, here in Birmingham. And so we're just going to get kind of right into that. Dr. Wadle, first of all, thanks for joining us today and taking out of your busy schedule.
Thank you for having me.
So just tell people, why did you make this big change? You own some urgent cares. You were deep into that field, the emergency medical field, and you completely flipped the script and opened up Renew My Wellness.
Yeah, well, basically for me, it was really personal. As I became middle age, so currently I'm 52 years old. I basically started to have a lot of fatigue, I'd say anxiety, depression, apathy, loss of energy. And I had never been like that before. And I couldn't quite figure out, what was wrong with me. And I just didn't feel like my normal self. And I came to understand that I basically got thrown into menopause because I had what we call surgical menopause, which is I had my uterus and ovaries removed. And it's a little bit harsher than general menopause because you don't have that gradual decline. And I really had no idea that the symptoms I was going to experience. And, I did what everybody does. I went to my doctor and I said, I'm really fatigued. I, feel depressed. I can't concentrate. I just don't have my get up and go anymore. You have no libido and you're just pretty much apathetic and you lose this enjoyment in life. And, appropriately, they say you're depressed or anxious or you have insomnia and or you have joint pain, they give you pain medications, antidepressants, sleeping pills. But the problem is, for me, what I came to understand was that my symptoms were related to hormone deficiency. So it didn't matter how many pills that I took, it wasn't correcting my underlying issue. And I'm not saying that some people don't need both, but for me, it was a real struggle. And then I did a lot of research. I went to my doctor. I asked if we could try some hormone therapy. She was supportive of it, but unfortunately, a lot of physicians don't have a great understanding of menopause and hormone replacement. And often women are just written off as you're menopausal, you're middle age, you're tired, and we tried a patch and it really did absolutely nothing. And then I ended up seeing a physician who recommended that I have pellet therapy. So I had basically an estrogen and testosterone pellet placed into the subcutaneous tissue of my the buttock. And I'd say over the course of several weeks, I started to feel normal again. And I realized that when I was looking around to see if there was other people that offered this treatment, there was very little out there. And I wanted to help both women and men, feel better and get back to feeling the way they did when they were younger.
So you felt pretty quickly then. I mean, it's not something that takes months and months of time.
It doesn't take months and months. It's very subtle. It's one of those things where, for me, I mean, it sounds crazy, but I knew I was better because I cleaned out my garage. I mean, it was just a struggle for me to get up every day and take a shower and, go to work. I mean, I was working 12-hour shifts, and when I wasn't working, I was sleeping, and I knew that wasn't me. And I had this incredible fatigue and, and you just don't feel good about yourself. And then once I got the hormones and I had some replacement, I'm still a work in progress, but I started to get myself back.
So is that a continuous treatment that you need to do, or is it just a one-time and it's taken care of?
No, it is. Basically, when you have it varies from individual to individual, but I would say you get pellet therapy basically probably quarterly, every 4 months. We monitor your levels and essentially probably 4 times a year. It really depends. If you're very, very active, you can burn through hormones and medications quicker. But generally, I would say every 4 months. But it's nice because it mimics the human body. We put the pellet in, it gives you a continuous stream of hormones. You don't have to remember to take a pill once, twice, or 3 times a day. You don't have the ups and downs that you'll get when you take pills or other forms. And it just gives you the most, in my opinion, a natural way that mimics what you already do with your human body.
So let's go back to this period in time. You went through this treatment, saw the major difference, and this was just something you felt obviously compelled to share with others and help others with. So how long after the treatment worked for you did the light switch on where it's like, I just need to open up my own practice because not enough people know about this?
Probably about a year, because I actually went and spoke with someone and saw, I went and kind of shadowed him a bit and saw what his how his patients were feeling. And what I found most commonly is women there is I'm not trying to be negative, but there is a lot of gender bias in medicine, unfortunately. And women often get labeled as anxious, depressed, crazy, and really a lot of it is hormone deficiency. And men, I think, are treated a little bit differently. Women, as they age, it's like if they're not sexually active or aren't outgoing, we accept it and we say, well, you're middle age, you're old. And women, need to have a really nice and productive life as they age as well. And there's absolutely no reason for it. We also do treat men. I treat a lot of men get testosterone pellets, and that really improves their libido, as well as their energy level. I'd say some of the most common complaints from both men and women are fatigue, decreased exercise endurance. No matter what they do, they can't lose weight, because when you have testosterone deficiency, you end up with a lot of that middle weight gain. So you'll see a lot of people that lose their waist. And I mean, the bottom line is it's an option, and it's helpful, and it's natural, and it doesn't, with a lot of the pills that I was prescribed previously, it makes your brain foggy, it makes you tired. And I didn't want that, so this was an alternative for me, and it's worked quite well.
So, the biggest challenge is having access to this treatment for people. That you noticed that there was deficiency in that, but once you've gotten that word out there that you offer this, the next challenge is getting people over that stigma and that fear of hormone deficiency, hormone issues. What are some of the conversations that you've had with people and the challenges that you've had to just get them past that
Well, some
initial
of the
struggle?
biggest challenges is in 2002, the Women's Health Initiative did this big study. And, if anyone can recall that, that's when they started taking all women off of hormone replacement, stating that there was this huge increase in breast cancer risk. And then actually, if you really look at the study, isn't quite true. First of all, they were using synthetic medications. It looks like most of the causation was progestin. And the study wasn't very good. The average age was like around 60, 63-year-old females. They excluded people that had hot flashes, and I believe 50% of them also were smokers. So that just gave them a higher risk in general. I think in the medical community, due to that study, it really did some damage. And, we need to start as physicians looking at this as an option. What I've chosen to use is not synthetic. I use pellet therapy. They are, like I know everyone says, bioidentical. And what does that mean? Basically, what it is it's a man-made or compounded medication that is its molecular structure is the same as endogenous hormones like that we already have in our body of estradiol and testosterone. And you also, by putting it into the subcutaneous tissue, are avoiding a pill where you then enact the clotting cascade, and you can avoid those risks of, whether it's clotting or other untoward effects. But basically, I think also for patients, it's a really uncomfortable topic to talk about, because you are like sitting there saying, I don't have energy to brush my teeth. I don't want to get up. I don't want to have sex with my husband or my spouse or whatever. I'm just trying to get dressed every day. And you feel like there's something wrong with you, but everyone tells you you're fine. You end up drinking tons of coffee, Red Bull. You're trying to do everything you can to, be your normal self. When in reality, there is quite frequently a hormone deficiency that is contributing to your signs and symptoms.
And is there a certain age range where people should start to look at this as a viable option?
You basically, once you're, I'd say, they say the average age of menopause is probably about 51, 52. I would say you can be premenopausal too in your 40s, but anytime you know, it just varies from 40 to, you know, 60, whatever. Basically, if you're having symptoms, then what I would recommend is that you have a full history and physical, and basically get an extensive blood panel and see, you know, where your hormone levels are. Notoriously, men, as soon as their testosterone level drops less than 500, they will have a lot of signs and symptoms. Because when you're young and at your peak as a male, your testosterone level is usually about 1,000 to 1,200. Women, they have a lot of issues once their testosterone lowers. We all seem to think that that's a male hormone, but actually it is one of the most abundant hormones in the female's body, and it's just as important as estrogen.
So, you know, other than your success story, Dr. Wadle, give us an idea of another one so people that can kind of resonate with people to just
Sure.
to see how well this works.
I can give you a female and a male. I've had a female who came in, patient in her 50s, menopausal, who was very emotionally labile, crying, was, you know, having issues with the relationships, imagining people were thinking things that they weren't, was of course attributing it all to, you know, I'm working so much, which we do to a lot of people. We say, oh, you're working too much, but really, do you start working more, you know, when you're in your 50s? Do you suddenly become acutely depressed? You know, there's probably something else going on. And she really thought it was a lot of stress from work. Her friends were noticing a change. And I basically drew her blood. She was very deficient. I gave her both estrogen and testosterone pellets, and she's back. She's like a new person. You know, she's happy, smiling. She told me she's going to be my poster child. And she actually said, you know, I get up and brush my teeth every day. You know, it's like I'm back to like the way I was. I don't have this, you know, depression or apathy any longer. I also have a male. He's also in his 50s, and we just did a testosterone replacement. And he told me that, you know, he gets up in the morning and he doesn't have that fatigue. He doesn't feel the need to snooze, gets up, and he says that with his wife, his libido's increased and their relationship is much improved.
It's fantastic. Hey, I would love to help you have more success stories. So, you know, what's the best way for people to get in touch with you and schedule an appointment?
We have a website. It's called renewmywellness.com. Full, you know, exactly how you think it would be spelled. You can also call us at 248-602-3177. And you can also email us at provider@renewmywellness.com. And, you know, all consultations are free. You know, we can always get some blood work and just see where you're at and go from there.
And how quickly can people get in right now in terms of scheduling?
We're open, and we will accommodate anyone who wants to come in. So I'll make it work for you.
Well, fantastic. Thanks for taking the time, Dr. Wadle. That, you know, that's what this podcast is all about, is to try to shine a light on some unique things that people don't see every day, and highlight people that are taking a chance like you are and something you're so passionate about. Hey, even if we can connect you with one new person from doing this, it was well worth our time. So thanks for coming on.
Great. Thank you so much for having me. I appreciate it.
Thank you.